We're sitting here with Gerard Lombard from Medwell SA.
Medwell, it's a company that's growing significantly at the moment. It's a company that's got 25 years experience in the home healthcare industry. Originally started as a family business, so there's a lot of passion and compassion in what we do. But we do two things primarily. The one is providing home healthcare services to people in their homes across the country, and the management of retirement villages and the healthcare services within those retirement estates. Now, the models in each estate is different. In some cases we do the full extensive services, and others we only provide primary healthcare and home healthcare services. We're contracted by most of the medical aids in South Africa to render home healthcare services at a variety of clinical levels, from procedures right up to palliative care, end-of-life care. So it's an exciting industry, and there's a lot of growth for the future for us. I've been consulting for about 14 years on retirement villages specifically, and we see a significant change. Most of the developments are pushing towards home health care being the preferred option, and we even see existing retirement villages closing their care centres because of the cost of managing these facilities. I think there's also a big push from the medical aid side because they're funding a lot of the home health care services now, versus care facilities are regarded as a social responsibility. So it's changing. Out of the 15 that we're operating now, and the 30 we'll be managing in the next 5 years, 50% of those estates will only have primary healthcare or preventative healthcare and managed home nursing services as the preferred option. Definitely. There's also, if you look at the local marketing of new estates, everybody's focusing on lifestyle estates. It's not a retirement estate anymore. People are living longer, they're staying longer independently, and we want to try and facilitate that to create a time in your life where you can stay independent as long as possible. And the focus is, in some cases, you can stay independent even with a little bit of support and care if need be. But the idea is to allow you to age actively in the comfort of your unit and enjoy the golden years as far as possible.
Without further ado, Dr. de Villiers.
I'm a family physician by training, which means my speciality is primary care, which worldwide is shown to be the model of choice, and not necessarily a standalone, but referring to secondary and tertiary care. Medwell SA specializes in providing managed home health care services at home. So what we are trying to do is to provide patients and residents with the assistance they need to maintain, firstly, their independence, staying in their home for as long as possible, and also when they're sick, to be able to manage at home rather than being institutionalized either in a hospital or in a frail care center. So talking about your model, which is a very important one, is providing primary care to the residents in that small community. So especially for an elderly population with an increase in chronic disease, it's exceptionally important to maintain the health status to be as good as possible. Because if you don't achieve that, you get end organ disease, which then lands you in hospital, or get you to physically deteriorate to such an extent that you lose your independence. So primary care, and from my speciality, is a very important component of the care that you are going to provide within that particular community. It will also do regular assessments which will identify areas where care is needed. Now, the range of services that could typically be provided in the home, by the way, also includes when you early discharge from hospital after a procedure.
Okay.
So
your typical step-down facility.
And not even, because it's not a step-down, it's care at home.
Sure.
So we create an environment of healing in your residence, and that is possible. And especially when your spouse is getting older, we provide that assistance to make it possible. So because you're surrounded by your loved ones, the healing takes place a little bit better. So we can achieve at least the level of quality of care that you achieve when you would have stayed in hospital. And that is our aim. And frequently we prevent people from developing pressure sores and so on because they stay in hospital for too long. But from another perspective, the services provided by home health care in general prevent you from going to hospital in the first place. So if you have a chronic wound that need care, it could be, if you need a drip for antibiotics or others, it could be given at home. Another important aspect, if you have a life-limiting disease like cancer or something like heart failure, we provide end-of-life care. And worldwide, the research shows us that people's choice is to die at home. So we provide the comfort needed by the patient, symptom relief, which is critical in palliative care, and we walk with that family through that very important phase. So people are surrounded by their loved ones, which is probably most of the important aspects of quality of care towards the end of life. Conceptually, the fact that the community and that particular small community decided to put their emphasis on primary care must not be underestimated, because the primary care is preventative.
Yes.
It's early identification, it is early treatment, and it helps you to postpone any end organ failure due to your chronic diseases. If one look at very specifically frail care centers that we frequently see in retirement villages, the percentage is very low. Probably less than 5% of those requiring care land up in a frail care facility. Absolutely. So in my philosophy, if I can treat everybody at home, that is what I want to do. There is circumstances, and it's usually either psychological, emotional, or social, where it becomes very difficult to treat somebody at home. So we take all of those factors into consideration before we advise where a person should be treated. A patient-centered approach means exactly that. Firstly, providing access to care. And I think one of what the things that you are doing is providing that. The second aspect is to respect the needs, the culture of the individual. And then the importance of bringing the family into the decision making, that's part of the unit. That is very important. We're focusing not only on physical care, but also on the emotional, the psychological, the social. So we're treating the person, not the disease, not the wound, not the drip that they need, but a person with all their needs.